Thank you, Nick. Thank God it's Friday. I remember as I was a kid, my father calling me and lights up a cigarette and tells me to take a drag. And as the little good girl that I am, I do, and I cough and I splutter and I go red in the face, and he says to me, "Now you know you should never smoke." After a short time, I was orphaned by my dad's heart attack. Now, as a doctor, I rise up to the challenge of seeing people, communities, who have a lot of information, yet don't have the knowledge to put it into action. We've become a culture of content obesity, starvation of knowledge. We have smartphones, yet stupid people. I mean, Henry Ford said, if I asked people what they wanted, they would have said faster horses. But he gave them the engine. Our engine, our minds, our brain, there's a notion that we only utilize 10% our brain. And apparently we have two brains. One is primitive, instinctive, automatic. And the other one is executive, calculating, has foresight. Our behaviors and interactions with the environment are based on preconceived ideas and previous experiences. So there comes an opportunity where we can reshape that environment around the primitive brain to have the desired healthy behavior. And that is what we call choice architecture. And apparently in my practice, I've been using this intuitively. One of them is the messenger, the doctor, the conventional doctor. I have gone beyond that label. What a doctor is now, a disease fixer. And I'm taking this off because I don't want to be a disease fixer. I want to go back to what a doctor was and what it should be. Transcending the social norm of a doctor. So what it was and what it should be is the shaman, the healer, and a confidant, and which makes it easier to use the nudge of a commitment, the promise that I promise you, and I promise to the patient that I'll be with you along your journey. And you have to promise to yourself, be responsible for your behavior. And of course, we have witnesses, because it's contractable. And throughout the 4 years I've been practicing here in Abu Dhabi, I've seen considerable amounts of weight loss, reverse diabetes, higher compliance rate, happier people, engaged, and paying it forward to their families and communities. Threefold, fourfold. I mean, look at Apu. Apu is trying to influence the choice of Homer Simpson into going to fruit and vegetables. That's choice architecture. That's nudging him towards fruit and veg. So well done who've taken the stairs today. We've nudged you. If you looked, it says elevator out of order. Actually, they weren't out of order. We just placed them there. We are primed. You know, if we look at a fuller plate, we feel full. So smaller plates that are full make us eat less. If you think about what we're doing here today, or what I'm doing here today, it's a call for all of us. I mean, look at the way we're made. We're human. We have joints. We have muscles. We're made to move and exercise. If we don't use them, they're going to fail us. So these solutions, when they are simple, intuitive, and enjoyable, they are sustainable. To live a good life, you need to live a good life. And when I go back to my father's story, he nudged me when I was young. If I could just time travel, I go in the past, maybe someone could have nudged him to stop smoking. He would have been here today. And he'd be looking at me and saying, "Good on you, girl."